Hello, and thank you for joining Path Forward today. This week marks 1 year since the first COVID-19 vaccines were administered in the United States. The speed to market and proven safety of not just one, but multiple vaccines has been a miracle of modern science and should be celebrated. But despite this hopeful milestone, there are still great challenges on the horizon. The Omicron variant of COVID-19 has now been detected in more than 75 countries and more than half of the United States. Just this week, the World Health Organization Director General said the Omicron is spreading at a rate we have not seen with any previous variant. So we are once again at a critical moment in the fight against COVID-19. But as we've heard from many guests on this program, the U.S. is much better prepared to address these new challenges than we were in the early days of the pandemic. Today, joining us to discuss what we know about the new variant, what information we can expect in the coming weeks, and where we stand in the fight against the pandemic is Dr. Anthony Fauci. With a career dedicated to infectious disease research, prevention, and treatment, Dr. Fauci has been a leading expert and trusted voice throughout the pandemic and long before that. He's been the director of the National Institute of Allergy and Infectious Diseases since 1984, advising 7 presidents on domestic and global health issues. He was also named chief medical advisor to the president at the start of the Biden administration and has continued to help lead our nation's COVID response. We were delighted to host Dr. Fauci on this program in July of 2020. And while I wish the conversation had moved on from COVID, it is certainly great to have him back. I know we all have a lot of questions for him, so let's get right into it. Dr. Fauci, thank you for being with us. Let me put up a map here on where we stand right now with current transmission levels in the United States. We see a large majority of states in the red indicating high transmission. Can you tell us what this means about the current state of the pandemic in the United States?
Well, before we even get to a discussion of the Omicron variant, what you see on that map there is more than 90%, probably around 95% Delta. So we are in the middle of a Delta resurgence because we were coming down after the summer surge that we had around the 4th of July and beyond. We came down to a moderate level. And then over the last several weeks, we stalled in our diminution and then started going back up. We were down to around 60 or 70,000 cases a day. And now we're up to 115,000 cases, an increase in hospitalization, and more than 1,000 deaths per day. So we are in a very difficult situation because we have about 50 million people in this country who are not yet vaccinated, who are eligible to be vaccinated. And although vaccine does not necessarily protect you completely from being infected, it certainly goes a long way to protect you from getting seriously ill, requiring hospitalization. So the very vulnerable people that are on that map of our nation are predominantly, not exclusively, but predominantly the unvaccinated, and which is that the reason why, as we get into the depths of the winter, with the travel and the holiday season upon us, that it is essential to get the unvaccinated people vaccinated. And importantly, particularly with regard to Omicron, which is a threat in front of us right now, that boosting individuals who have already been vaccinated is going to be very, very important.
That leads me to several questions at one time, Dr. Fauci, but let's start with, what do we know for certain about this new variant?
Well, there are a few things we know for certain and a couple of things that we can make a rather reasonable assumption about. The first, that we know for sure that it is highly, highly transmissible. It is the most transmissible virus of COVID that we had to deal with thus far. It has a doubling time of about 3 days, which means if you do the math on that, you see how quickly over a period of time that the dominant variant will be Omicron, as it is in South Africa, as it is now approaching that in the UK. And if things go in the United States the way they've gone in other countries, and there's no reason to believe that that won't be the case, it will soon become dominant here. So that's one thing we know. The next thing we know is that when you look at the rather large number of mutations on the Omicron variant, it is predictive and has shown in reality to evade certain immune parameters, such as monoclonal antibodies, many of which are no longer effective against this virus. Also, the antibodies that are induced by vaccination lose much of their potency. That's the sobering news. The somewhat encouraging news is that when you boost someone who's been doubly vaccinated, you can reconstitute a lot of that diminished protection that occurs because of Omicron. It may not protect much against infection, but it will go a long way to protect against severe disease. So therefore, underscoring the real importance of getting vaccinated as well as getting boosted. And then finally, there has been some hint that this particular virus, although it spreads extremely efficiently, it might lead to a less severe disease. We have to be careful that we don't make that assumption as being absolute fact, because there are conflating and confounding issues that could explain why in South Africa it appears that the ratio of hospitalizations to infections seems to indicate that it is less likely to wind up in the hospital. We don't know for sure if that's the case, because it may be due to the fact that in South Africa, there's such a high level of seropositivity, namely, so many people who had already been infected and recovered that they may have some baseline immunity that protects them from getting severe disease. So we have to reserve judgment as to whether or not it truly is a less severe infection.
So, Dr. Fauci, you raised the difference in the potential difference in severity of illness based on vaccination status. And I know that makes a lot of people concerned about children, both children who can't get boosted or even who can't get vaccinated yet. And so, what advice do you have for parents of young children, employers of people with young children? And also, what advice do you have about this coming holiday season for that group of people? And also, when do you think we'll be boosting and vaccinating more youth?
Okay, so let's take one issue at a time. We now are authorized to vaccinate children 5 to 11. So the first recommendation is that if you have a child within that age group cohort, and there are about 28 million children in the United States that are within that age bracket, we strongly suggest to parents that they get those children vaccinated, because although the disease, if COVID, is generally less severe in children, children are not completely exempt from severe manifestations of COVID. There have been about over 2 million children in that age group infected. There have been over 8,000 to 9,000 hospitalizations and well over 100 deaths. In addition, if children get infected, they can spread the infection, perhaps to vulnerable members of their family or their associates. So if they are old enough to get vaccinated, vaccinate them. If your child is young and not in the eligible category of getting vaccinated, the best way to protect them is to surround children with people who are vaccinated. And that's one of the reasons why we talk about school teachers and other people, particularly family members. When you get vaccinated, you indirectly protect those who are unable to be vaccinated. And the final question is, when are we going to be able to vaccinate children who are younger than 5 years old? Right now, the studies have been done and are continuing to look at the safety and the efficacy of vaccines in the age group of 2 years old to 5 years old, and then ultimately 6 months of age to 2 years of age. Hopefully, those data will be available in the first quarter of 2022 to allow the FDA and then ultimately the CDC to both approve as well as recommend vaccines for that age group.
You mentioned both the efficacy of antibody treatments and vaccines on this new variant. Let me ask you about testing. I've read that the PCR tests do pick up this new variant, seem to be effective. What about the tests we can buy in the drugstore? Do they also pick up Omicron?
Well, we're getting preliminary information that not all of the diagnostic tests will be accurate with Omicron. Some, and many of the commonly used ones, appear to pick up and detect Omicron quite well. But we're hearing, and we're in the process of doing large screening to determine which of these antigen point of care rapid tests still maintain their accuracy of diagnosis. But clearly there are some that do. We're trying to find out those that don't reflect an accurate result and find out, and if we do, then to make sure that those tests are not used to diagnose Omicron.
So thank you for that. It'll be important, of course, to get that out as soon as we can. We'll look forward to hearing what you discover. We have a bunch of audience questions, as you might imagine. Let me roll one from Ron in Arkansas.
Hello, Dr. Fauci. My name is Ron Ekstrand, and I'm with Easter Seals, Arkansas, here in Little Rock, Arkansas. My question for you is, based on the latest available information about the Omicron variant, what can you share about its differences from other variants in terms of its severity of symptoms, its contagiousness, and its resistance to vaccines?
Well, clearly it is highly transmissible, the most transmissible variant that we've experienced thus far. As I mentioned just a moment ago, it certainly diminishes the effectiveness of monoclonal antibodies, of the entire panel of monoclonal antibodies. Most of them are no longer effective against the Omicron variant. So we're going to have to start developing new monoclonal antibodies that are well matched to this variant. With regard to vaccine-induced antibodies, it diminishes the effectiveness of these against protecting against infection, less so in protecting against severe disease. But fortunately, that diminution is largely reconstituted by a booster shot, a third shot. Just a moment ago, it appears that there is anecdotal hints that it is less severe than, for example, Delta. But we have to do many more studies in real time before we can make that as an absolute statement.
You know, you mentioned when we looked at that map that we're looking at a wave currently of the Delta variant. And now as we see the new variant coming on and the spikes we're seeing around the globe, I'm curious what your models are saying are the different scenarios we could be confronting from best to worst, both in terms of infection rates, but also hospitalizations. Are we anticipating another big wave in January?
You know, I think we have to separate what we're dealing with right now at this moment, which is a resurgence of Delta. So Delta is still a serious problem. I mean, we're looking over our shoulder at Omicron, which will assume a dominant role very soon. I would imagine within a period of a few weeks to as we go into January. However, when you look at the Delta that we're dealing with right now, we're having an increase in every parameter, an increase in cases, an increase in hospitalization, and deaths are still at 1,100. So we are in for a difficult situation, particularly among those who are unvaccinated. They are very vulnerable. And that's why you hear me and my public health colleagues essentially plead with people who are refusing to get vaccinated that they do get vaccinated, as well as those who are vaccinated to get boosted. Otherwise, it is inevitable when you look at the pace of the infections now that things will get worse as we go into the depth of the winter. And with Omicron breathing down our back, things could get really bad, particularly for the unvaccinated. The vaccinated and those who are boosting, I believe, will be relatively well protected, at least against severe disease.
You know, as you might imagine, when you're talking to a business audience, we get a lot of questions about the potential impact on the economy and on local businesses. And this next question from Brianna in California gets right to that.
Thank you for your time today, Dr. Fauci. I'm Brianna Goica from the Mammoth Lakes Chamber of Commerce in Mammoth Lakes, California. With what is currently known, how likely is it that this variant will cause business closures or limited business operations?
You know, Brianna, that is a difficult call to make. I think it's going to really depend on how well we do the interventions that I just mentioned a moment ago. If we follow the CDC guidelines about when you are in indoor public congregate settings, to make sure you wear a mask, even if you are vaccinated. And if you are vaccinated, please get boosted when your time comes. And certainly, if you're not vaccinated, get vaccinated. If we do that, I don't believe we'll have to be doing any kind of shutdown with regard to businesses in your community. I think we can continue to go and do what we've done now, as long as we're prudent about our care for things like wearing masks in appropriate settings.
So again, as we talk to businesses, one of the things we hear a lot about is, how do I talk to my employees? How do I engage on the information and misinformation that's out there? And this next question from Elias in New York gets to that question.
Hi, Dr. Fauci. I'm Elias Enenbach, Advocacy and Communications Manager at Core Group, joining you today from NYC. So I'd love to hear your insight as to how can we most effectively counter misinformation and promote COVID-19 vaccine confidence, especially as the pandemic continues on. Thanks for taking my question, and thank you for all of your work.
Elias, that is a very important question, and I think we can only answer it in one way. It is unfortunate that there's a considerable degree of misinformation and information that is propagated by the social media. And the only way we can think of countering misinformation and disinformation is by literally flooding the system with correct information. So I would encourage people. I mean, when you look at tweets that occur and Facebook postings that are absolutely inaccurate, misleading, conspiratorial, or what have you, those who feel that they want to counter that should actually get on the internet, get on your Facebook, get on your tweets, and counter that misinformation. Talk about what the real true information is, and put aside and debunk those kinds of theories or what have you about safety and inefficacy of vaccines, which are completely untrue. We have a highly effective intervention in the form of vaccines, which are clearly very, very safe. And it is really unfortunate, and from a public health standpoint, almost painful to see that misinformation and disinformation is preventing people from getting vaccinated and, in essence, endangering their health and their lives. We know from a recent study that came out 2 days ago that the vaccination program that's been implemented has saved 1.1 million lives and avoided 10 million hospitalizations. That's what vaccines do. So anyone that's propagating false information about why you should not get vaccinated is essentially endangering the lives of people in this country.
One of the things we've talked about on this program is that in addition to endangering lives and spreading COVID, people who are unvaccinated allow the virus to have a host where it can mutate and learn to get around vaccines and treatments that we have. And one of the themes that has led to is the idea that COVID anywhere is COVID everywhere, and the need to really solve this global pandemic globally. Can you talk to us a little bit about the US strategy in combating COVID as a global crisis?
Well, let me address what you were saying about what I think you're referring to as our communal responsibility. There are people, many people, who feel I'm young, I'm healthy, I'll take my chances. If I get infected, the likelihood is that I won't get a severe disease, which, quite frankly, is a dangerous assumption, given that we've lost 800,000 people have died of COVID in the United States thus far. Having said that, that is a false assumption, because if you get infected, as you've alluded to a moment ago, if you get infected, even if you don't get severe disease, you are a vehicle of transmission to another person. So you essentially are helping to propagate the outbreak, as opposed to being a dead end to the outbreak by getting infected and passing it on to someone else. You are a vehicle of spread. So people should think not only about themselves in a vacuum, they should think about their societal responsibility as a member of society to help to crush this outbreak. Now, with regard to our global responsibility, I feel, and I've expressed this publicly, that we have a moral responsibility as a rich nation to do what we can to get lower and middle income countries to get vaccine doses that they could use. Because you're right, an outbreak anywhere in the world with a respiratory illness as transmissible as this virus is a danger everywhere in the world. And thankfully, the United States is doing a lot to be able to get doses to people in lower and middle income countries. In fact, we're doing more than all of the other countries in the world combined, giving hundreds of millions of doses. And by the middle of 2022, we will have given 1.1 billion doses to low and middle income countries, as well as donating $4 billion to COVAX, which is the organization that's been formed to be able to get doses of vaccine to the developing world. So you are absolutely correct. We do have an obligation to the rest of the world because of our resources.
I know you have limited time, and it's hard to get all the questions in that we're getting from the audience and other people, but one of them, and let me just pop this up. I think this is the New York Times headline that suggested that although 1 in 100 Americans over the age of 65 has died of COVID, the latest data that we're looking at here says that only about half of this population has received their booster shot. So the question is, what can we all do about that?
Well, what we can do is listen to this fireside chat and hear me say that it is essential for people, particularly the elderly and the vulnerable, but quite frankly, everyone who has been vaccinated, to get a booster shot. We know that immunity wanes over time, even against the Delta variant. And we know that from rather substantial experience. However, with the threat of Omicron, we know that the protection, even without waning, the peak protection of vaccine-induced antibodies against Omicron is dramatically diminished because of the mutations that are in Omicron variant. And so if you get boosted, you increase and reconstitute that level of protection. So one, you should get boosted because waning immunity to any virus, but two, you have a diminished immunity of vaccine-induced antibodies to Omicron, but you can go a long way to helping to reconstitute that immunity to protect you, particularly against severe disease.
You said a minute ago that as kind of Delta and the new variant and the flu kind of converge, that things could get really bad. What does really bad mean to you? Are we back to the stage of hospitals being overloaded and big infection rates? I mean, what does really bad mean to Dr. Fauci?
Well, it's just that. I mean, besides the toll of suffering and death, which will inevitably go up if, in fact, we have that convergence in the winter months of flu and Omicron and Delta, we could get our hospital systems overwhelmed. We already have throughout the country, because of this 2-year ordeal that we've all gone through. We have an exhausted cohort of health providers, doctors and nurses who've been knocking themselves out now for almost 2 years to yet again another surge that puts pressure on the healthcare system is going to be very, very difficult for the brave and unselfish healthcare providers, doctors and nurses and other healthcare providers. That's what we're concerned about.
I know you only have a few more minutes. Let me try to get one more audience question in here. This is from Gun He in Washington, D.C.
Hello, my name is Gun-hee Lee, and I'm a student at the George Washington University Milken Institute of Public Health, calling in from Washington, D.C. I wanted to ask Dr. Fauci regarding how effective the COVID booster shots will be against current and future variants of COVID, and how often we will have to receive booster shots from here on out. And thank you, Dr. Fauci, for your time.
We know now with Omicron that the effectiveness of the vaccine is diminished. But as I mentioned a moment ago, it is quite well reconstituted by a booster shot. So what we are assuming is that since the vaccine was against the original ancestral strain, but yet still protected against alpha, beta, and delta variant, and likely with a boost will protect against the Omicron variant, that we believe that looking ahead, if we continue to get people vaccinated, that we will be able to counter the emerging variants that we might see as the months go by. However, having said that, we still are prepared for the possibility that we might have to develop variant-specific boosters. But quite frankly, I don't think that that is going to be necessarily, certainly not right now in the immediate future.
Yeah, I'll give the last word to you, Dr. Fauci. As you're talking to an audience of the nation's employers, small and large, what do you want to say to the job creators and the messages that they can get out?
Well, my message is one that I repeat over and over again. Hang in there. This will end. We can get through even a winter surge by implementing the countermeasures that we have: vaccinations, boosters, masking in indoor settings, being prudent in caring, for example, about wearing a mask indoors. You can enjoy the holiday season with your family if you're vaccinated and your family members are vaccinated. But we will get through this. I don't want people, even though we've been through a terrible ordeal, to think that this is going to go on forever. If we do what we have available to us, namely the countermeasures of a highly effective and safe vaccine, we will get through this and it will end and we will get back to normal.
I appreciate that very much, Dr. Fauci. You know, we've said from the beginning that science will win. We've been really proud of the business community's role in this and grateful for leaders such as yourself. So thank you for what you're doing. I hope you get some rest over the holidays. And thanks to all of you for tuning in. Stay tuned for details on our next program soon. Get vaccinated, get your booster, stay safe, and enjoy the holidays.